Today is World Cancer Day, a celebration which aims to prevent millions of deaths each year by raising awareness and education about cancer and pressing governments and individuals across the world to take action against the disease. World Cancer Day 2022 marks the first year of a new 3-year campaign centered on the issue of equity with the theme Close the Care Gap. This year's awareness draws attention to the lack of equity in cancer care. Now, according to WHO, cancer ranks as a leading cause of death and an important barrier to increasing life expectancy in every nation. A 2019 study found cancer to be the first or second leading cause of death before the age of 70 years in 112 of 183 countries. In 2020, there were about 19.3 million new cases and 10 million cancer deaths worldwide. Nigeria is currently estimated to have 233,911 cancer cases, with 124,815 new cases and 78,899 cancer deaths yearly. This is scary, if you ask me. But the point there is we have in the studio General Secretary, Association of Radiation and the Clinical Oncologist of Nigeria, Dr. Ololade Kehinde. It's nice to have you join me this afternoon. Great. Now, on a day like this, draws our attention to the seriousness of these issues that people don't want to talk about, that people don't want to associate themselves with. In fact, the moment you mentioned cancer, oh my God, it sent some kind of shivers and all of that. Yeah. But talk to us about the numbers. If we check the trends over the years, it seems we have more number of people having this, and even at younger ages.
Well, a few factors are responsible for this. One is the fact that, there's a little bit of, there's an increased level of awareness. There's more diagnosis is being made, and the challenge we've had is that the level of awareness increases the number of diagnoses being made. We now have more patients that have cancers, and but that is not matched by the availability of treatment. So so we have like that disconnect, but there's a lot of more awareness. Previously, people would pass on, and there will be an assumption that the reasons why they died was unknown. But right now, with post-mortems, with histopathological diagnosis, with more radiology, more CT scans, and all that, and with the new PET scan in town, people are able to identify that, okay, radiologically, and even following the surgery, people, unlike previously where people are not able to pin down a diagnosis, right now there are things like immunohistochemistry and all that can tell us there's a cancer and a particular type of cancer as well.
So right now, one of the reasons we have higher numbers is because we're able to detect and find out the actual numbers.
Yeah.
Okay.
And there's a lot of, there are even more cancer registries that are taking records. I mean, the level of awareness.
Better data.
So there's there's more capture of data, and with that capture of data, we are able to say that within a year we have about 102 new cases of cancer diagnosed in Nigeria. We can now say, okay, now, but mortality is still around 70,000 annually and all that.
So. Let's talk about the issue of prevention, which everyone says is better than cure.
Yes.
Now, what are these everyday habits that we can? Some people feel that people cannot exclusively prevent cancer. If it's going to happen, it's going to happen. But anyway, here and there, of course, there are some habits on a daily basis that we can indulge ourselves or not indulge ourselves to ensure that we keep cancer away.
Well, we have particular cancers like cervical cancer, for example, which the main organ that normally causes it is human papillomavirus. And fortunately, science discovery has got to the level where there's immunization against the human papillomavirus. So, people that are yet to be sexually active, once they get human papillomavirus vaccination, the chances that they're going to come down with cancers of cervical cancer is very minimal on that part. People that have liver cancers come from like liver cirrhosis from like hepatitis and some alcoholic involvement. So if people reduce the intake of alcohol, it will help. Then some people have hepatitis B vaccine that they could take, people that are exposed and all that. Then then also smoking worsens or increases the risk of an individual coming down with lung cancer or getting even better treatment or coming out from treatment very well. So, you know, so those are some of the habits. Then also, one of the things is that people that are not sedentary, they are very active, their immunity is optimal, much more than people that are just sedentary, from AC to AC to AC to lift. They don't use the stairs, you know, and all that. They do
in the house, you have AC, in the car, AC, you know, in the office, so
they don't sweat, they just round and round and all that. So, you know, those are some of the things. If there's increased activity, there's a better diet. I mean, the broad-based balanced diet, not all the time one particular kind of meal and all that. There's a mixture, I mean, to help the immunity. All
right, the theme for this year, Close the Care Gap, is instructive.
Yes.
Because the word care is really central to this thing. What should we all know about what's the centrality of care in this cancer situation?
We as Association of Radiation and Clinical Oncologists, one of the things we've realized is that majority of the patients that get to us would have gone round and round with wrong care in wrong places. People that have no business treating cancers have had access to them because of the fear people have. So we've had people use all kinds of treatment. So the target for us as an association right now is that people should be treated by an expert. I mean, a study was done in the UK and realized that a lot of people that don't do well with chemotherapy is because 50% of those that administer those chemotherapy have no business administering chemotherapy. I mean, chemotherapy is like a gun, and a gun in the hand of a trained soldier is for protection, but in the hand of someone that knows next to nothing about it is like a bomb that is waiting to happen. Yes.
All right. Thank you so much, Dr. Ololade Kehinde, for the insight. We look forward to greater days ahead in the area of care for people and also prevention, which is very central and key. Thank you.
You're welcome.
Thank you very much. Right.